thousands of children each year are diagnosed with various disabilities. These numbers continue to grow as the rise in multiple birth increases.
There are now 1 in 68 children being diagnosed with autism. This is an increase of 57% since 2012. What we need to do is help these children be more inclusive in society and help them progress to the best of their ability.
So what is autism? Autism is a neurodevelopmental disorder affecting the function of the brain so that the child receives a lot of information, but the brain is not able to either process it or give the right responses. The signs of autism can vary from very mild to very advanced, and that's why they call it autism spectrum. Many children can manifest as just not communicating or not giving eye contact to their parents, and others can manifest in more behavioral and more functional disorder.
Autism spectrum disorder and autism are both general terms for a group of complex disorders of brain development.
Children often have difficulties with communication, social interaction, and often engage in repetitive behaviours like flapping, hand flapping or spinning. Children will have difficulties with giving eye contact, engaging with others. Children with autism tend to play alone and may not be able to ask for what they want. So sometimes you see a lot of challenge in behaviour because the child can't communicate appropriately that they want something or they want something to stop.
Any parents can usually notice signs in the first 2 years of their child's life, and signs often develop gradually. The diagnostic criteria require that symptoms become apparent in early childhood, typically before age 3.
A lot of people think that it's the MMR vaccine that causes autism, which is not true, since there's no research to back that up.
The signs of autism can vary from very mild to very advanced, and that's why they call it autism spectrum. Many children can manifest as just not communicating or not giving eye contact to their parents, and others can manifest in more behavioral and more functional disorder, where the child will have some sensory issues, like he cannot tolerate a lot of light or noise or even the touch of his clothes on his body. Or also can have some stereotypic behaviors like moving or spinning or even playing with things all over again and again and again. Some children may manifest with tiptoeing or flipping their hands like this. And these are signs that can be noticed in the first 3 years of life, and a lot of time medical doctors and parents need to reach a diagnosis, or even without diagnosis need to reach for help.
The signs and symptoms of autism differ from its effects. Some autistic children have only mild impairments, while others have more obstacles to overcome. However, every child on the autism spectrum has problems, at least to some degree.
Every child is unique when it comes to causes of autism. Some children may have genetic underlying causes, but others may just have autoimmune disorder. For example, their body cannot tolerate certain foods. These toxins build in the brain and cause the lack of communication in between the brain cells. Others may have underlying intolerance to certain food. Some people shown that their children are not able to digest certain amount of foods, and when they put them on a certain diet, they get better. But the truth is there are many causes for autism, and at the end of the day, every child may differ, and we might have combined causes together, maybe environmental, maybe the toxins in our environment. But we know that it is increasing. We know that there are more children diagnosed every day, and we know that there is so much research trying to identify underlying causes. Some people say vaccines. It might be that the child's immune system is too weak to tolerate certain vaccines, and of course they build up and cause reactions in the brain. Today we would like to look more positive at how we can manage a child who's diagnosed with autism, rather than trying to get really to know, because we know that it's multifactorial. It can be genetic, but in many children it's not. We've seen twins who are identical, one have autism and one doesn't. So we can't say it's really 100% genetic, but we know that it can be genetic in some children and it may not be in others.
0 to 3 years is the most important time in a child's life developmentally, and that's why we need to intervene early with children with autism in order to teach them the skills that they need in order to progress in life and have the best possible outcome. We need to look at teaching them skills such as communication, play skills, social skills, and then this in turn will help prevent challenging behaviour or inappropriate behaviour, because we're giving them the skills that they need to replace such behaviour.
Autism is not a disease. Some people wonder, my child have autism, he have a brain damage or something is wrong with his brain. The truth is, autism is a name that is given to a group of symptoms that a child manifests with, like the lack of social skills and the communication and the eye contact and the stereotypic behaviors. The brain itself have cells, and when the child is born, he has so many cells, but what happens is the function between the cells is inhibited. For example, as a computer that is not working, you don't know why it's not working. It could be it's not connected to electricity, the hard disk has a problem, the software has a problem. So it can be many things. And when we want to fix the computer, what we do is we deprogram the computer in order to install the new programs. And that's what happened with autism. So what we try to do is to re-establish the connection between the brain cells through early intervention and through repetition and through rewarding good behaviors. And this is why we can start to rebuild the connection between the brain cells. So it's not really autism causing brain damage, it's the function that is not there, and we try to re-establish this function. And the good news is the child from birth until 6 years, the brain is growing, is able to compensate, is able to establish connection, but we need to do the right thing. So a question, what is the right thing to do? The first thing to do is to find the right person to assess the child and see where he is compared to his peers of the same age. Identify the weakness of that child, what he can do and what he cannot do, the good things that can do and his favorite things, and then you use this to build a program that can help the child develop the skills that he is lacking. We call this early intervention, and it's basically applied behavioral analysis, speech and language therapy, occupation therapy, sensory integration therapy, vision therapy, trying to give all the things that the child need in order to bring back that connection into place and get the right responses from the child. When you call his name, he will look at you. When you say hi, he will say hi back to you. It comes with training.
We all know that autism is a very mysterious disorder, so even for the cows and the treatment, we are not sure what is exactly the cause happening behind the autism and what are the proper treatment. Even the parents are very curious sometimes what to do for the child if a child in a family have autism. This is a very stressful situation. So in such condition, we can give some preventive measures that might help parents to be alert to get a child from autism. Like if parents wants to go for their kids, or if the mothers are in the delivery period or in the pregnancy time, so we can get some preventive measures. Like we know from the research side that all the children of autism, or mostly of the children we can say, have gastrointestinal disorders. So during the pregnancy time or before the pregnancy, the mother should avoid at least white food items, like reduce the amount of sugar, pasta, pizza-like things or processed food. So this can be an important preventive measure. Other than very recently, I saw a research which have been done in the America a few years back. They tested the blood samples of the Americans, even the kids. So they taken the sample of around 148 synthetic compounds which are used for the processing the food items and the natural food products also. So out of that 148, it found that around most of the children who are in the sample size, they have around 116 synthetic compounds, and in these synthetic compounds mostly are the polycyclic hydrocarbon and dioxins are also there. So these are the very harmful insecticides. So we should have to avoid these food items. So even when if you feel that if you have in your mind that okay, my child might be an autism, if you have in your mind, so the mother should have to go for the blood sample test also. So if you feel that okay, your blood is overloaded with this toxic item, so you should have to go for the detoxification program or the blood cleaning program for these ones. So even after the birth, these samples have been found in the blood of the children also, even the milk products also, and even the placental tissues also. So even after the birth, if you feel the child have this type of chemicals, you should go for the detoxification program or cleaning the blood samples also. A part of that, you can make some small preventive measures like avoid using the water in the drinking water in the bottles, especially the plastic bottles, because the plastic bottles have some chemical reactions. Even it is not heated or soft plastic bottles, they produce some chemicals with especially the dioxins or antimony also. So this is the heavy metals might be affect your child's. A part of that, I can say you should have to go for the regular checkup for the vitamins, because vitamin D is very important for the cardiovascular systems and the brain functioning.
Parents and healthcare professionals must closely monitor a child's progress and reactions while he or she is taking medication to be sure that any negative side effects of the treatment do not outweigh the benefits.
We're lucky today because we have more experts in the field of autism, and many children are caught up early through screening, developmental screening. However, we need to also be aware that not every child who doesn't look at his parents when they talk to him, or he's shy and hiding behind his mother when people are trying to approach him, that he have autism. There are normal behaviors that every child could go through between the age 2 and 5. They can constantly say no and not compliance to their parents. It doesn't mean that they might have behaviors, but it doesn't necessarily be autism. Parents get confused because they hear a lot about autism. They hear about the signs, and they think their children who are typical and normal and they have no problem that they do have autism, or what if my child will develop autism. It's very important that a proper clinical psychologist specialized in the field is the one who does the assessment and the evaluation of your child. It's also important that you don't run into giving medications because your friend have given it to their children. It might not work. Really, the treatment for autism is either early intervention or behavioral intervention, and then later as they grow up, you have to give them social and communication support to build this knowledge and comprehension of human behavior, because the children really have very low social understanding of the cues and why people are angry or why they are happy, and these are support programs that the child would need as he grows up. The importance is that for parents, when they see something that is not really the routine or normal, they do go to their pediatrician, express their fears and their concerns, but a proper evaluation have to really rule out, because there are some other disorders where the child electively choose not to talk. They call it mutism, and when they do that, parent may think that my child cannot talk or he's not verbal. Also, autism is interesting because it's one of the most difficult to treat developmental disorder, but it's the only one that the child can get out of and move in the spectrum from very severe into moderate, and from moderate to mild, and from mild to complete recovery.
A lot of children with autism tend to live in their own kind of little world. And what we need to do is bring them out of that and teach them, how to communicate with us, communicate with parents, to other children, to siblings. And it's the most important thing that we can teach a child is how to communicate with everyone around them. And the first thing that needs to be taught is to request something that he or she wants. So something that they really enjoy, and we teach them how to request it in an appropriate way. This can be either using words, sign, or picture exchange. By doing that, we can replace challenging behaviour that occurs, so tantruming, and because now they have a more appropriate way of communicating.
There is no cure for autism, but the best research method for treating autism is applied behavior analysis. The ABA programs are specific and unique to each child. It's comprehensive. The child needs between 20 to 40 hours per week of one-to-one, but these programs will teach the child the skills and the tools to learn, to comply, to be able to be included in mainstream schools with typical children. With ABA and a combination of treatments like sensory integration, occupation therapy, and speech therapy, the child can really develop a lot of skills that can help him to advance into school and hopefully later on into college. I would like to only stress on the fact that some children may have sensory issues and they really need occupation therapy, may need also vision rehabilitation. Some may need feeding therapy because they cannot tolerate eating any food, or they are scared of eating food. Some children are sensitive, and the desensitization program can let the child learn how to adapt to changes in light and in noises, and be able to accommodate going to different places without fear and without tears. Writing is another skill. Some children have weak muscles. The exercise can help the child to gain a lot of muscle tone and help them to success in school. The mother have to notice if the child have problem with walking or coming down the stairs, or running, or riding a bike, because these are gross motor muscles that needs to be exercised as well. And occupation therapy is the tool to help him develop the muscle tone and the strength and the ability to cope with the school requirement, where they can participate in exercise and swimming, in climbing. So this building the muscle tones can help the child.
So in the 2000, I think it was one children of autism was found around in 150 populations, but now it is gradually increases. So if you see in the 2010 data, one autism is found in every 68 children. So it is a very huge amount, and it is a very solid data. So, and even you look for the other countries report or the Asian continents or European studies, they found that 1% of the populations have autism in the prevalence report.
The Center for Disease Control in 2013 have released the results showing that there is a child in every 50 children affected with autism. It's a growing neurodevelopmental disorder that we need to learn more about.
Autism culture is a difference and not a disorder.